Hey guys, we're coming to you again from the YouTube channel Therapy Rocks, talking about the characteristics of complex PTSD. What I'm doing is reading out of the appendix from the book that I wrote called The Upset That Comes with Little, a handbook for trauma survivors struggling with spontaneous age regression. If you find that you like this information, please remember to like and subscribe. And if you're interested in getting a copy of the book, let me know what your information is, and I will make sure I get you a copy. Okay, so today we're going to be talking about symptoms of complex PTSD to include delayed emotional development. And then if we have time, we'll do one more. I want to keep these videos pretty short. Delayed emotional development, again, it sounds like a term where when we talk about kids that have learning disabilities, it's not really what it is. You know, these kids have learning delays. This is more about parts. This is more specifically about when you, again, are functioning like an adult in your life, and then you get triggered, you have a spontaneous age regression or emotional flashback, whichever you prefer to call it, and then all of a sudden you are really responding more like a 2-year-old or more like a 5-year-old or more like a 15-year-old. So delayed emotional development is sort of like that. However, this is the way I describe it to people. I say some people stay big most of the time, and then they get little when they get triggered, but then they return to their baseline where they're actually staying big. So some people have been so badly traumatized that they don't have a well-developed grown-up part, or apparently normal part, or the most grown-up part, or the most spiritual part, whatever you choose to call it, with whatever language you're learning. Some people don't have that older part, so all they have is the young parts. And that's what I would refer to more as a delayed development, so that people are walking through their entire lives really operating out of those child parts or part. So I hope that kind of delineates it between people that are staying big a lot of the time, and then when they get triggered, they get little, versus people who are just stuck in little, I call it. Okay. The next one is phobias or panic attacks, and I'm sure that most of you have either experienced a panic attack when you get triggered, and certainly there are some phobias that are attached to having been traumatized as a child. I know that people have told me stories where, you know, they are claustrophobic now because their abuser used to maybe put a blanket over their head and try to smother them. Those sorts of things. I had a patient one time this is probably 30 years ago, whose abusive father hung her upside down over a railing, threatening to drop her. And so then she developed a fear of heights. So sometimes phobias are not related to trauma in childhood, and then sometimes they are. And it's pretty clear when they are. So hopefully that's clear. Panic attacks are horrible and need to be treated aggressively. So if you are having a panic attack once in a great while because you got triggered, that's one thing. But if you're starting to have multiple panic attacks every week to where it's affecting your ability to function in your job or at home, then you need to see your doctor immediately and get treatment for those. Panic attacks that are free-floating panic attacks, not necessarily triggered by anything, respond very well to SSRI medication. So just talk to your doctor about that. Confusion about sexual identity and norms. So again, when you're little or you're triggered into little emotionally, your emotional parts are little, there's obviously going to be a lot of confusion about who you are, about what is normal, for an healthy adult sexual relationship. That is not uncommon. A lot of times people talk to me about being sexually abused in childhood and responding sexually to a perpetrator when they didn't want to. And I explain to them that our bodies respond whether we want them to or not. Our bodies respond to touch, and certain parts of our body are going to respond to certain types of touch. So, I've had patients who have had difficulty with fetishes that have developed out of their abuse. And then, of course, they feel guilty about it, even though it was an unfortunate pairing that happened in childhood. I'll give you an example. Thank goodness, this was almost 40 years ago. I was probably 19 years old, so it would have been 37 years ago that I was a brand new therapist, and I had a patient one time who had been molested by a father and beaten by a father, and he dragged this child around, and this child remembers having a wool coat on, and this child remembers getting an erection while he was terrified. So there was an unfortunate pairing of fear, excitement, and wool coat. And unfortunately, that person developed a fetish where he had to have his partners wear wool coats in order to feel sexually aroused. So I know that might sound bizarre to some people, but those things happen, especially in childhood. And the first sexual experience that people have is extremely powerful. So there can be some unfortunate pairings, like there could be a pairing of sexual excitement with pain, sexual excitement with like a wool coat or some other fabric, sexual excitement with dirty diapers, sexual excitement with feces. Who knows what it could be? But these unfortunate pairings happen in childhood, and then because it's the first sexual experience, and it becomes very powerful, and then it can go on to be acted out in your sexual relationship. So I hope that's clear. If you have questions about that, certainly feel free to reach out. Confusing sex with love and or intensity. That happens a lot. And I work primarily with women, so I'm going to say that a lot of the women that I've worked with really get these two things confused. I tell them love is not necessarily only a feeling. It is behavior, it's choice, it's a verb. Many women will get very attached or addicted to the intensity of the new relationship. And then when the dopamine cocktail wears off after about 2 years, because it's supposed to wear off, they freak out because they think they no longer are attracted to the person, they no longer love the person. And then I have to explain that love is something that builds over time in a relationship. Lust, infatuation, the dopamine cocktail, whatever you choose to call it, that is what we have at first. And that lasts for about 2 years. And then after that begins the hard work of building love in a relationship, which is based on choice. So an example of loving your partner, a simple example would be you're tired, it's been a long day, you come home from work, the first thing on your mind is you just want to get a big tall glass of ice water. Maybe your husband's been home all day long and he's retired and you're still working, and you get yourself a big glass of ice water, and a little voice says, why don't you ask your husband if he'd like a glass? Part of you saying, hey, he's been home all day long, he should be serving me. But love says, I'm getting one for myself. Let me see if my husband wants one. Even when I don't feel like it. That's love. And so that's one example of it anyway. So that's much different than lust or infatuation. So that is what we're going to talk about today. And next time we will get into 3 or 4 more of the symptoms. I think it's really important to go into each symptom in depth so that you can really have an understanding of it, so that you can figure out how it's manifesting in your life. Hope everybody had a great 4th of July weekend. I pray that anybody who's feeling activated because of something that happened over the weekend, that you would reach out to your support person or people. Feel free to reach out in the Traumatized Not Crazy group. That's a group that is on Facebook. If anyone's interested in joining that group, that could be a place where you could find some support when you have emotional flashbacks, because we all know how difficult they can be. So we're praying for everybody, and we just hope you have a great week. And we'll see you soon. Thanks. God bless.